For people with uncontrolled and severe asthma, life can be unpredictable and downright scary. NuvoAir has launched a comprehensive asthma home monitoring and support service designed to expand clinical capacity for diagnosing, treating and improving outcomes for these high-risk patients. We went to Liverpool to learn more.
If you can't get a breath, which obviously happens a lot, it feels like the end's come. It feels like you're just going to die.
Take a big breath in and blast out as long as you can.
60-year-old Macbeth was one of the 1.3 million people in the UK with uncontrolled asthma. After decades struggling to control his symptoms, he was referred to a hospital in the northwest, which enrolled him in NuvoAir's asthma service.
Take your big breath in.
For 12 weeks, he was monitored virtually by a NuvoAir respiratory physiologist to help assess his condition. At home, using his spirometer connected to the NuvoAir app, Macbeth regularly recorded his lung function, medication use and symptoms, so specialists could pinpoint the correct treatment.
It showed over a long period of time exactly how my breathing was, and that's what I always wanted. So, and then that got me to get these biological injections that's really helping. I would never have had that if I hadn't went on this 12-week assessment to see how I was. Since I've taken it, it's really helped me. It has sort of turned my life around.
The patient data collected by NuvoAir is delivered to NHS clinicians and enables them to make faster, more informed clinical decisions about diagnosis and treatment. One renowned respiratory specialist told us why NuvoAir's service is game-changing for asthma sufferers and the NHS.
In the past, we didn't really have the tools to have the kind of longitudinal awareness of what was happening to a patient with asthma. And it's so critical in asthma because asthma is a disease that varies over time. You know, a patient could be controlled one day, but then get a viral infection or have exposure to, air pollution, for example, and then lose control. And by empowering patients with monitoring technology at home that allows them to report their symptoms frequently, but also monitors the use of their inhalers as well as their inhaler technique. This is a really powerful tool if it's then integrated with NHS care services to give us a system-wide awareness of what's happening to patients with severe asthma within a given clinical service.
This specialist nurse highlighted some practical benefits for the NHS.
Using NuvoAir is really helpful because you can remotely review your patients, which then in turn frees up clinic capacity and to enable you to get more patients through into the system. And then with that freeing up of space, you can see more sicker patients if you need to.
Each year in the UK, asthma accounts for 121,000 visits to A&E, 78,000 hospital admissions and more than 1,000 deaths. While most sufferers receive emergency therapy, around 80% aren't going on to be referred to the correct specialist, who can then provide the appropriate treatment.
NuvoAir's Director of Clinical Operations believes its asthma service will radically improve these statistics.
I think uncontrolled asthma and managing people with uncontrolled asthma will remain a challenge for the NHS. There has been new guidance that's been published this year, which is designed to help identify and optimise the treatments of people with uncontrolled asthma. And I believe that in partnership with clinical services, that we will be able to accelerate patients through this pathway, support clinical teams to make faster decisions about diagnosis and treatment, and ultimately get the right therapy to the right patient at the right time.
For Macbeth, there's no question NuvoAir has been life-changing.
Things like coming here to the woods. Before it took me an hour and a half to walk around this, sitting on every seat that was available, and now I can just sort of walk and meander around here, and it's a lovely place to come with the dogs. Between the monitoring and the help and encouragement through NuvoAir and then the injections I get now, life has become a lot easier for me.
With its unique combination of connected technology and respiratory physiologists, NuvoAir hopes its asthma service can engage and empower many more patients like Macbeth to take control of their symptoms and live a better life.
Come on, let's go.